Hey, Aeroflow Sleep followers, it's Megan, your marketing coordinator for Aeroflow Sleep. We're here for another segment of Weiss Words with Dr. Carleara Weiss, and we're talking about how do you know if you have sleep apnea? Dr. Weiss, what are we going to do?
That's a great question, Megan. Hi, everyone. So I think this question, we have two different things to look at. The first one is the symptoms that everybody knows or everybody heard about before that may be connected to sleep apnea. That is snoring. So if you snore or somebody told you that you snore or if a loved one is snoring, it's a first sign that they might have sleep apnea. The second sign is choking or gasping for air during sleep, right? So that's another sign that is very common, and you want to check that. The other part is the signs that not everybody know that may associated with sleep apnea, and those are waking up with a dry mouth the next morning, having fatigue during the day, having severe daytime sleepiness, that you fall asleep when you're watching TV or fall asleep when you're sitting on the passenger seat in the car. Um, Also, having difficulty concentrating during the day, feeling headaches during the day. And the last part is also having intense fatigue. So if you don't know why you're so fatigued and you feel like you wake up the next day feeling more tired than we were when you went to bed the night before, having the dry mouth and all that, those are also signs that you may have sleep apnea. So it's important to get that checked.
And that's how they diagnose you with sleep apnea, right? They use a sleep study, and if I remember correctly, it's an apnea hypopnea index. Try saying that 5 times fast.
Yes.
And that AHI is registering how many times you stop breathing during the night. Is that correct?
That's absolutely correct. That's how we do the sleep studies. And we have to see how many times the person is stopping breathing overnight. And in some cases, we can do that at home too. So don't be afraid of learning that you have to do a sleep study. We can do that at home too. And it's very important for your health.
Now, do these signs show up all together, or can you actually have one versus the other? Does everybody snore that has sleep apnea?
That's a great question, Megan. So, not everybody that has a sleep apnea is going to snore, and not everybody that snores has sleep apnea. It's kind of like it's the chicken or the egg, right?
Yeah.
So, it's important to see if you snore occasionally, but you don't have any other symptoms. It might be just that night you're not sleeping in the right position. But if you snore frequently and you experience those symptoms as well, those additional symptoms as well, you may want to have that checked.
Wonderful. So now y'all know why you could potentially have sleep apnea, and how do you find out if you have sleep apnea? Of course, talk to your doctor if you have any questions, and we'll talk to you next time. Bye, everyone.